Bismillah ar-Rahman ar-Rahim. Your Highnesses, Excellencies, ladies and gentlemen, on behalf of Hevolution Foundation, I would like to welcome you all to this memorable event. Human medicine has made significant achievements in the past 2 centuries addressing a lot of diseases. However, as we grow older and we manage to live longer, new chronic diseases have emerged, whether cancer, Alzheimer's, or other chronic diseases. The healthcare system has been managing and dealing with these diseases separately, increasing the costs on the healthcare system and the pension fund, etc. In response to this challenge, longevity dividend has emerged. And for that, the point is to address the biological causes of aging and to slow down the biology or the age issues as we grow older. Please join me in welcoming Lord John Bethel and Dr. Hani Jukhdar in discussing the longevity dividend. So I'll start with a question about, for both of you, about the systemic prerequisites to realize and maximize longevity dividend. How about what are the essential elements that we have to have in the healthcare system?
You go first. Well, I think that one aspect is there needs to be belief in our politicians, in our clinicians, and amongst our patient/electorates that the dividend does actually exist, that there will be a big payback for investment in healthy longevity. Now, I think everyone in this room is here because we all believe that that thing exists and that we are evangelical in our belief about it. Yeah. But we haven't won that argument yet. We haven't seen a big change in the direction of our healthcare systems from late-stage acute medicine to early-stage preventative medicine. We haven't seen a big investment in creating the infrastructure to make the most out of this longevity dividend. And that's partly because we haven't had the confidence that if we change the direction of investment, if we change the roles within our healthcare system, if we change the political priorities of our health proposition to our people, that there will actually be a big payback. So I think there is a political infrastructure and an economic infrastructure and a social infrastructure that is yet to be built before we can really enjoy that dividend.
Great.
Thank you, James. Actually, aging is happening. And with aging, you need to create sustainability in the economy. To create sustainability in the economy, you need to have healthy aging. Healthy aging requires actually healthy old population, and you need to have a productive old population. The two must go together. You cannot have one and not the other. And to have healthy aged population, you need to fulfill the 4 pillars of healthy longevity, which is you need to have a pillar on the socioeconomic, a pillar on the environmental, a pillar on the behavioral, and a pillar on the biological. So these 4 pillars, we need to focus on them. And our vision, the 2030 vision of Saudi Arabia, is focusing on that actually. Longer life, healthier life. So we need to have healthier life and longer life. We need to have a huge effort on the environmental, on the behavioral, on the socioeconomic, and the biological. And if we look into each one of them, behavioral, we are through our team-based healthcare system, which is the family physician for every individual in the country, is focusing on making the behavior of the people to look into their health rather than wait for the illness. So we want to tackle obesity, we want to tackle diabetes before it happens, create an environment where easy, healthy living is there, walking environment, clean environment, reducing a greenhouse country. Actually, we are focusing on those. Socioeconomic, trying to create jobs for the older population, not necessarily on the wage or rely on the wage. You can have the volunteering, you can have the social working, and you can have also the entrepreneurship. It's a pillar. And on the biological, make sure that all screening program for older population are there available. That will prevent costing and the spending on the older age population.
Great, great. Also, as we look into the longevity space, definitely as part of pushing the envelope forward, we need to look into the economic benefits and then how the population will realize potential as we move along. So this becomes a very critical case when it comes to macroeconomic political discussion. So what are the potential economic benefits for longevity and longevity dividend as well that we can look into in order to prepare for the future?
No, I think this is the absolutely critical question. You know, the other day I was sent something that argued that smoking was good for economic performance of the country because it killed off people before they became expensive for the healthcare system and saved us an absolute fortune in terms of social care. And the curious thing about this argument was it took me quite a long time to economically refute it because there was a kernel of truth in it. And we are quite a long way, I fear, from really winning the argument on healthy longevity. Mm-hmm. I think that policymakers and the electorate still see longer life through the prism of increased social care costs and an onus on society. That is a big mistake. I believe, and I think we're in this room together because we all believe, that there's a huge potential dividend here. We have a fantastic expertise in our workforce that could be put to work for much longer than it is currently. If we can add years of healthy life to the contributions of people who work in our economy, that's a massive increase in terms of the productivity of our economy. And it saves in terms of healthcare costs, welfare costs, and social costs, a big burden on the taxpayer. And is well worth the investment in, as Hamid was referring to, early stage diagnostics and screening, in education, in terms of the kind of cancer tests that are becoming available. This fantastic revolution in prevention technology is going to cost money, and pivoting our investment from late stage medicine to early stage medicine, I think will have a big return on investment. But I know as a policymaker in the UK system, there's quite a long way to go to winning that argument, and therefore investment today in proving the economic value of healthy longevity is something I think we should all be trying to commit to.
Great. Yes. Dr. Hani, as we look into the global efforts in longevity and how it contributes to better and healthier lifespan for human beings, how can the region benefit out of all of these global movements across the world around longevity to be able to move forward?
If we look back, and if we take one country that has very much complex society or complex background of the people, which is the United States, and look into the history of the United States between the 20s of the last century and the 20s of this century. Between the 20s and the 70s, most of the promotion to human life or to the lifespan of the human was related to reducing childhood mortality and young adult mortality from vaccinations, from treatment. And from the 70s toward the 20s of the current century, most of the extension of human life is happening because of the intervention on the health care screening and prevention of diseases, of other diseases, not the diseases that cause morbidities and mortalities on the youngsters. So it's totally different category. So the vaccination and the treatment has done its job even in our society, because we have a very good vaccination program for children and young adults. We do have very good intervention program for therapeutics in the GCC in general. So we have reached the era where we extend the life to 60s or early 70s. But now the second phase, I think we need to focus on. So the second phase is making healthy living for the older is really challenging, because you need to make sure that they are engaged in the society, they are productive, and you need to make sure that they are not liable to get sick with aging sickness, which is Alzheimer, cancers, and chronic diseases. So we need to have a very strong preventative program, and that's what we are creating in Saudi Arabia and the GCC as well. The other challenge that we have in the GCC, the expatriation. The expatriation that will make us difficult to be comparable with the Western countries, where expatriation is high, and many of the expatriates that come to the GCC, they come to target certain period of life and they leave. So even if they come in, they will eventually bias your data of longevity, healthy longevity, because they will leave and another population, so we will not see the big chunk of the older population. But if you go down and stratify your population based on locals and or permanent resident, including those expatriates who are willing to end their life in the countries, count them and look at that group, and you implement a stronger interventional programs for healthy living at older age. It's quite challenging, and I'm sure all the GCC government are taking a very strong steps to provide that longevity, healthy longevity, and the strong longevity dividend from older population.
I couldn't agree more with Hamid, except where at that very last comment, I see a real struggle amongst policymakers in the developed world, because they have made these big commitments to their population, that the health service will be there for them when they're really seriously sick. And the costs of providing that sickness service are becoming completely overwhelming. And we feel this very, very hard in Britain, for sure. And the resources available for exactly the kind of screening and early interventions and application of prevention technologies that Hamid quite rightly described aren't being made available, I think, with the sufficient commitment. And one of the arguments that I think we need to win as people who are evangelists and leaders of the longevity agenda is to make that argument for the pivot of resources from sickness to prevention. And that's the only way that we can win on this agenda.
Great. I wish we had more than 15 minutes. I have to close with this, I think, extremely important question, which is longevity dividend worth it from a political standpoint? Should governments give longevity dividend a priority in their agenda?
I think we are seeing it in Saudi Arabia. We are very much empowered in the Ministry of Health by the government to take over the screening program. We were supported strongly by the government to create more screening program for cancer screening for women and men, and we are going to add more. We see that the quality of life program it's one of the visions essentials in the 2030, and the quality of life program, which is I'm a part of it because I'm in the board, and that actually focuses on how to make quality of life helping you to live longer and better. That is the ultimatum of that the quality of life program. And we do see how the projects in the country now looking at green, looking at how make the environment clear and suitable for you to live longer, healthier, and how the creation of walkability program, making the country have a very strong, very broad walkable areas in the cities like Riyadh and Jeddah, where you have a big population. So I'm 100% sure that there are strong initiatives, there are a very strong major steps are taken to make longevity healthy and make it productive.
Yeah, I agree with Hamid. There are some very, very strong pull factors, and I think it should be in people's natural interest to want to lead healthier, longer lives. But I am also conscious of the disruptors, those hurdles that we have to get over. And I think we have an argument with our own healthcare systems and our own clinicians, the surgeons who want to spend more money on operating theatres and the cancer cures that add a few days of life. These are really tough resource decisions that are going to be need to be made in order to take resources for healthy longevity. We have an argument to win with our patients and electorate that the role of the healthcare system is not simply a fallback plan for when your health goes badly wrong. It is a partnership with the state to support your healthy lifestyle and your healthy ambitions. And we have our arguments, I think, over the very large amount of resources that are going to be needed to do the double running of looking after our existing chronic diseases and also to reduce the flow of illness into the population by intervening earlier in people's lives to try and head off those diseases. That double running is going to require a big investment, and I'm not sure if socially and economically we've quite got our heads round what is going to need to be required in order to achieve the ultimate objective.
And this is absolutely linked to the point of inaction that Victor Zhao alluded to earlier today, thinking of the consequences of not taking serious action towards achieving this objective. Lord James and Dr. Hani, I really appreciate your presence. Thank you so much, and thank you for the attendees.
Thank you.
Thank you, Salman.
Thank you, sir.